My favorite part is probably working with the military members. It's pretty rewarding. They get to go all around the world, and you're sort of supporting all those missions, and a lot of things that, like, I was kind of naive before this. I thought, like, the Canadian military were probably not up to much, and then you're working in it, and they're just going all over the world in places that, like, you don't even hear about in the newspapers. So you get to kind of sort of indirectly know about all these like cool missions and places, and yeah, that's a lot of fun.
How much top secret, cool, classified stuff do you get to hear about just as part of the grapevine and talking to your patients?
I'm not at liberty to say. No one's supposed to talk. So yeah, no one's supposed to talk about it. It's not supposed to be talked about. It's need to know basis kind of thing.
We'll edit that question out. We'll pretend like that never happened.
Yeah, but they have to let you know, right? Like they're like they'll have to let you know like where they work, because there's the whole like travel medicine aspect of things when they go in some kind of like remote place and they come back with some kind of symptom, and then they have to tell you, and then you're like, whoa, I wonder what this could be, because a lot of times, like, it's not something that we learn in like medical school or residency, but there's always help and always support.
Yeah, I guess you got to be up to date. You're like tropical diseases and all that sort of like weird and wonderful stuff that you might pick up abroad.
Yeah, but there's always an on-call specialist that you can just, like a military specialist, like internal medicine and whatnot. If you have any questions, you just pick up the phone and call them, and they'll just like talk to you right away. It's very different than the consults you do as a resident in the hospital, where sometimes the consultants are kind of like, giving you a hard time. These guys are always happy to like chat and answer the phone.
The good work environment, good
Yeah,
team.
that's right.
What are the patient cases typically like? I'm envisioning a whole lot of MSK and that kind of stuff.
It's a lot of MSK and a lot of, like, minor traumas and that kind of thing. The typical um, kind of stuff that you would expect from like people on courses where they're jumping around and swinging from ropes and parachuting and all this kind of stuff. Um, and also mental health as well. Um, you get a lot of that, and then you still get like your cancers and your weird like autoimmune conditions and the other stuff that you see in a typical practice. So you still get a lot of that stuff. And sometimes, with these members, they get to military members, they move around quite a bit, like going from base to base. And so you'll pick up things that got just lost to follow up, or they'll come in with something that, like, clearly they should have been seen for like a long time ago, like a big like hard lump or something that's been growing for like a year, where they were just like, I just was just going to tough it out, that kind of mentality. And they come in, you're like, whoa, you should have like come in a long time ago. So you still see some pathology. And
I'd get that a lot with like my patients that were farmers. Like they're just so tough and they tend to, as a consequence, let things linger for a little while too long. You probably get a little bit of that same vibe with the, you know, tough young crowd.
yeah, so that tends to be the case. Like when people come to see you, it's usually like things are pretty bad. No matter like what the presentation is, it's usually like, you get the pretty advanced, like, yeah, it's whenever they're decompensated and can't do things anymore. Because the other part of the job is you're kind of there. Um, you give them what are called like medical employment limitations. It means that medically they can't do certain things in the military, and that has like repercussions for their like career advancement and this kind of thing. So they're kind of like their careers get put on hold while they have these limitations, and so oftentimes they don't want to come in because of that. So
I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.